Hello, everybody. My name is Glenn Silloway. I'm the Social Policy Director of the League of Women Voters of San Luis Obispo County. Welcome. We're glad to have you with the Lunch with the League. This is, I think, the 6th or 7th in our series of episodes on homelessness. This is one of the most important policy focus for the League of Women Voters, and our members have cared about it for years now. We're still going to be working on more webinars in the future on this. We'll be recording this webinar, and we will be posting it on our YouTube channel and on our website, just so you know. Today, we have an expert panel, and that's putting it mildly, to talk about the draft 5-year strategic plan to address homelessness. The plan is a big departure from business as usual, with a focus on coordinating housing and services for those who are experiencing homelessness on a countywide basis. There are a lot of moving parts. This panel we have includes the right people to bring these issues into focus. First, Susan Funk. Susan is the chair of the Homeless Services Oversight Council and also of the steering committee that's a subset of that council. She and her group have been instrumental in developing this plan. Joe Zvonik is, I believe, a member of that steering committee as well, and he is the county's homeless manager. He's a principal analyst who works in the social services department. And Joe is joining us on that little telephone from an undisclosed location in the high desert. Sam Blakesley is our former state senator. You all know who Sam is. And he's the founder of the Institute of Advanced Technology and Public Policy at Cal Poly. He and Greg Gillette have helped to bring the issues of coordination of homeless and housing policies to the fore, and thank you for that. Greg Gillette is the principal of Gillette Law APC. He is a lieutenant colonel in the California State Guard, and as I mentioned, he's Sam's partner in advocacy on this issue. Now, we once again need to thank Nick Wilson, who is going to be moderating the discussion today for Lunch with the League. Nick is a provides communications guidance to the Cal Poly College of Business Science and Math, and he is also teaches journalism classes at Cuesta College. As you know from Sam's long time reporting for the Star Tribune, he followed the issues of homelessness carefully, so he's a good man to do this. All right, let me set the stage. We're going to start off with Joe and Susan doing an overview of. There'll be a slide share. You'll see some stuff on your screen, and they'll go through about a 15 or 20-minute presentation, at which point Nick will take over and ask questions of specific panel members. If necessary, any panel member can follow up on those questions. Because we have a lot of questions, they're curated questions. We've tried to put them in priority order, but it's a big, big topic. So we're going to try to time this so that we get through as much as possible. At the end, there will be a Q&A session. You can submit questions in a written format at will, and we hope to get to them at the end as much as possible. We are supposed to be going off air at 1 o'clock, but our habit on Lunch with the League has been to stay on later. If there's more to talk about and you are interested in staying, we'll stay for a while after as well. Okay, I think that's all the nuts and bolts. And turn it over to Nick, and thank you all for being here.
Thanks, everyone. Welcome, and this is a really good discussion to be having and a great panel. So I will kick it off we're doing the presentation currently, right? So Susan and Joe, take it away.
Thank you very much, Nick. Yeah, are you? Let me make sure that you can see my screen.
Not yet, Susan.
Okay.
There we go.
Okay. So let me note first that as we started to develop the countywide strategic plan to address homelessness currently, that this is not a 10-year plan. The crystal balls don't go out that long, and there's too much urgent work that needs to happen now. So this is a 0 to 5-year plan. And we found ourselves at the confluence of urgency and opportunity. urgency because this is a growing problem, and both in terms of the number of people who are homeless and the challenges there, and the urgency that we see in our communities who want their public spaces back. This is also a time of opportunity because more funding is coming available to address this problem than we have seen in a substantial period of time. And also the sense of urgency creates greater political will, which makes it easier to proceed. So let me find my page down. And we, as a commission, we established a vision that our region will reduce homelessness by ensuring that people at risk of losing housing can retain it, and those experiencing homelessness can equitably secure safe housing with appropriate supports, minimizing trauma to the individual, the community, and the environment, all of which are affected by homelessness. Our goal is within 5 years to reduce the number of people experiencing homelessness countywide to 50% of the current level. And that goal was established knowing that we are still addressing a growing problem. So we've accounted for that in the plans. The steering committee members that worked on this plan include a broad range of folks from different parts of the county geographically, but also city and county and not-for-profit and community roles. Include someone with lived experience of homelessness, and both staff and elected perspectives. And I want to thank each one of these people for their incredible effort on this, because everyone has put in a lot of additional work to make this happen. To understand what we've put in this plan, it helps to look at why are we where we are, and just by simple comparison of where were we pre-pandemic versus where are we now and why. So looking at what's been going on in homelessness, we've seen significant investments during this period of time in new capacity to address it. We have the Echo Paso facility, which was the conversion of Motel 6, expansion in Echo and Tascadero, expansions in SLO, new medical detox that is opening soon, the addition of the parking village is what is now referred to at Oklahoma Avenue, that is near the Animal Control Center, and new cabins for change under development in Grover Beach. We've also seen expansion of street outreach and other access that were specifically to COVID, or that expanded with COVID-related funding. And yet at the same time, we've added real capacity. Homelessness itself has been growing. We see in tracking the number of people who request services that are in the homeless management information system, that number of people is expanding by about 200 people a year, more than we can get their homelessness resolved. And we're still waiting for the 22 point in time count numbers. But in 2019, we observed almost 1,500 people homeless in the county, of whom nearly 1,200 were unsheltered. During this period, we also see that staffing in the harmless services organizations and in behavioral health and other support organizations has been stretched very thin, and staffing issues are a challenge. And organizations are concerned that the one-time COVID-related monies are expiring, and we need to make sure that we continue those services that are important ongoing. On the housing side of things, because our goal in addressing homelessness is to get people back into housing. We also saw the expansion again with Motel 6 conversion, with new emergency vouchers, new units under construction in a variety of places in the county, and an expansion of what's called the Housing Now program. It started out as 50 now, 65 now, it keeps going. It's been very effective. And yet at the same time, the housing market has gotten incredibly tight in this county. Very low vacancy rates. Rents are up 13.5% since in the last year, and 46% since 2016. And we've reached the point where the median rental household in the county now spends 38% of their income on housing. Now you want to keep that to about 30-35%. So it means that over half of all the rental households in the county are at increased risk of homelessness because of the strain that housing costs are placing on family budgets. We've also seen that the cost to construct new affordable housing has risen to over $550,000 a unit for the traditional ways that is constructed. And that shapes our plans. So looking at where we've gotten to, we've reached the point, despite effectively doubling our total capacity to shelter people, that we still can only shelter 20 to 30% of the number of people who were observed as homeless in 2019. And that's a best case scenario with no COVID restrictions, with everything staffed and open, with all our winter shelters and seasonal shelters open. That gets you to 30%. So we have a really large gap. So what we see in addressing that is that it's not so much that the individual efforts taken are ineffective, but that the scale of effort is not enough. We've essentially brought a garden hose to a house fire. And so in making plans, we're looking to address that with a series of sequenced changes. We're looking in the first year to focus on expanding our sheltering capacity and adding more temporary options to build more pathways out of homelessness and get more roofs over heads in the quickest fashion that we can. We're also looking to expand efforts in homeless prevention and early intervention, and to look at building better data capacities, because what you didn't see in that analysis was a really refined assessment of how many of groups of people with which kinds of needs are located where in the county, and how are those shifts changing, and which groups are being able to move faster and slower through the system. So where do we need to focus resources? We need to get there and get a system where we can regularly refine our plans using the data. But that means that we need better data capacity. And then we'll further be focusing on expanding the services that support people in these environments, and on finalizing a regional compact among the various jurisdictions that have a stake in this outcome. And we have housing capacity in years 4 and 5 in the model, not because it's less important or that we're not going to be working on it from the get-go, but because it takes 5 to 7 years for most of our typical housing projects to get completed, and they involve 6 to 8 different sources of funding. So the complexity is very high, and it takes time. I'm not going to go through all the details on this, because the particulars of the plan you can see in full detail online. If you simply Google HSOC San Luis Obispo or SLO, that will take you to the homepage of the Homeless Services Oversight Council with an easy click link onto the plan in all of its detail. But you see here that our focus in the first 12 months is rapid implementation of non-congregate shelter or temporary housing capacity of many different kinds, and also to look for funding to expand staffing and services in mental health and substance abuse orders, and to expand the training and coordination that we offer for the staff that are doing these services, and laying the groundwork for our regional compact. As the time progresses, we're looking to build those capacities so that we can reach that end stage where we have, where we are systematically looking at how we're doing and what results are being achieved with these efforts, and being able to refine the implementation strategies accordingly. This will be coordinated through both existing and new entities in order to make this work happen, including both our Homeless Services Oversight Council, or HSOC, which meets a very broad membership, but it only meets twice a month. every 2 months. And it's a 3 screens of Zoom meeting. So we needed a roll up your sleeves team to manage the implementation that is going on concurrently. And I'm going to turn it over now to Joe, showing the bubble chart, Joe, so that he can tell you about that work, because he's the one that is in charge of making these things happen.
Hey, thank you, Susan. So I just want to make sure that you're on slide page 10 of 12
Yes.
still. Okay. Yeah, so I just want to describe this. This is really just a sort of a skeletal view of what I call the communications about homelessness and the entities involved in that currently in our county. It's not meant to be all encompassing. It doesn't, and this is something as I brief the slide, it raises a lot of questions. So I just want to state the purpose of it is really just to talk about, the current pathways on the discussion of homelessness within the county itself. And it, like I said, doesn't include nonprofits. It doesn't include volunteer organizations and homeless advocacy organizations. So just want to clarify that. So what we're saying here in this slide is that we're not intending to add any new layers to government to get this done. One of the concerns that a lot of people have is that in order to effectively address homelessness, it may require more layers of bureaucracy or new layers of bureaucracy within the county, which already has enough. And when I came in to look at how things were handled in the county, in typical county business, and specifically with homelessness, I identified after a while that I felt there was a pathway that already existed that we could use to get things done quickly. And that is in the center of the slide, which I call it the Regional Homeless Action Committee. And this between the county staff and city managers. And the good thing is this meeting already exists and has for a long time. And it's just simply the meeting between the city managers and the CAO of the county. When we started implementing this strategy and developing it, I went to that meeting. And it's when it occurred to me, like, hey, this could be a good place that we could talk about this, these specifics of the plan. I'll show you, how we'll all look at that in the next slide. But they quickly, the city managers and the CAO quickly agreed that this would be a good forum for that, and was willing to basically change the format of that meeting to have 1 hour. It's a 3-hour meeting or more every month. And we are going to dedicate 1 hour or more every month to talking about some of the specifics of the plan. Of course, that's not going to be the only time we meet, but that will be the centralized meeting that we all get together and look at the plan. And that'll generate, spin-off meetings and secondary meetings between the county and individual cities moving forward. So, Susan, if you could please go to the next slide.
Okay.
All right, and what you should be seeing there is something called our 5-year operational approach. And what this is really, it is the implementation mechanism of the strategy. The strategy goes, if you remember a few slides ago, I believe on slide 8, you see like what we call the big blue bullets. Those are sort of the wave tops that Susan talked about. In the first year, we have 3 focuses: expanding our sheltering capacity, homeless prevention, and data. Years 2 and 3, we improve our service capacity, develop a more formalized regional compact, and in years 5, Susan described our approach to increasing traditional housing capacity and then having a data-driven process within the government. So this is what you're looking at now here on page 11 of 12 is the mechanism that is going to implement this. And what it allows everyone to do, and when I say everyone, I'm talking about specifically with the meeting where the city managers and myself and county staff, and eventually we'll get to something building a homeless division within the county that I'll get to in a little bit during our discussion. So this here is it's a project management tool. Or what you call an operational approach to implement the strategy. And I'll walk you through it here. Just bear with me for about 60 seconds and it'll make a lot more sense. So if you look at the left side of the slide, you see what these things are called lines of effort. There's LOE1, LOE2, and LOE3. The current strategy, we've already actually broken LOE5 into 2 separate ones. So this is based on a draft, and until we actually brief the board of supervisors, it's not really formalized. So But this was the origin of our operational approach. We have 5 lines of effort. And the way we look at it is homelessness, in order to break it down into the individual components without going further than we had to, what were the larger individual components that we can break homelessness as it exists into, and then figure out a way to attack each of those components to eventually reduce homelessness. So for example, we say that what's one of the components that causes people to be homeless? It is a lack of shelter or housing that's affordable and appropriate to what we have in our population. Another thing that may be causing homelessness to exist and grow is perhaps not enough services and not enough ability for those people who are about to become homeless or are homeless to navigate the variety of systems to get out of homelessness, to figure out where do I start based on my individual problems. So that was our line of effort. 1 was building shelter or housing affordable and appropriate. Line of effort 2, which we call supporting effort, was to expand services and navigation. So without getting too much into the details, each one of these lines of effort are broken into major components that we believe contribute to homelessness, but they're enough that they can stand alone, but yet they support each other. So for example, we know that trying to build the right amount of housing and the right affordability, the right type of housing, is critical. But building housing is not the goal. Reducing homelessness is the goal, and they are not the same thing. Homelessness has other issues that go with it. You can give a brand new home to someone who may be homeless, but without services to help with perhaps addiction and mental health issues and other, budgeting issues, job skills, things like that, getting somebody a home is not necessarily going to solve the problem. So all of these things are, we felt, related, and that's why the main effort is to build shelter and housing, because we know that is ultimately the key, but all the other lines of effort support that main effort. And then we could see, if you read through the strategy, which Susan described, is on the link and you can read through it, we expand on each one of these. Now, again, this is a notional diagram, but we can see that line of effort 1, if you look at the left side, we say we want to build shelter, housing, housing affordable and appropriate. For example, so the first green diamond that you see may be an example of a project or an event that is going to be an objective along that line of effort that will accomplish the end, to get to the end state of that line of effort, which is getting a mix of safe parking, emergency transitional shelters, and housing exists in the area to reduce unsheltered living. And what's good about, what this slide, what this map here allows is that, all the people in the county, across the county, they're going to help us work on this, can look at this map right here and see what everybody else is doing. We can see what we're doing as a community and make sure that we're addressing all the major components of homelessness together in a unified vision, unified effort, and we can see where we have gaps and where we have overlaps and try to prevent that. And we have that in our data management. We can look at that in our funding mechanisms and our regional collaboration and the way we communicate with the public. Those are all the lines of effort that we could see across several years in our plan. Next slide.
So now we're,
And I think, go ahead, Susan.
yeah, now this moves us to discussion time in this slide.
So why don't I jump in here and we can kick off the questions, if that makes sense, Susan. So let's, start us off with, I know one of the criticisms sometimes is that you can have a great plan, but how does it come to fruition? How do you know that it's going to have teeth that leads to real change? Joe, what assurances can you give us that some of the things you're talking about are actually going to make a dent in the problem, a big dent? Or
so, first of all, am I unmuted? Can you hear me?
Yes.
Yes.
Okay. Yeah, well, I think, in the way that the question was framed, is what, will this plan have teeth that lead to real change? And, the difference is, there's planning itself, as they say, plans are worthless and planning is everything. which means that, you know, it's the idea of planning itself that allows us to adjust our way forward once we start to take action. As you know, the greatest laid plans are look great until you actually start to take action, and then it may not be working, but you have to build agility into the plan. But the other part of it, to get to your question, is you have to start somewhere. And we have mechanisms. What we build into this plan as a major part of it is the mechanisms themselves. So we're not sitting around coming up with this plan and then we said, oh, we forgot who's going to be the person or persons or organization that's responsible for this, who's going to be held accountable for this. We're trying to build different levels of accountability into it. And we'll talk about that during the question and answer session, where we talk about a Citizens Accountability Commission. And we talk, I just talked about our Homeless Action Committee, where the city managers and Susan and I have gone to all of the city councils and the Board of Supervisors, and we're going to go back to all of them and say, this is our promise. We are going to do our best to reduce homelessness by 50%, and get everybody involved in that plan. So we're putting it out there as much as possible to all the different levels of government in the region, as well as the citizens themselves. And we are saying this is our plan. And we're building, we just saw in the last two slides with the Homeless Action Committee and also the implementation mechanism, that we have action built into it. And if you look at other plans, and I've read some of the previous homeless plans to address homelessness in our county in particular, the 10-year plan from, I think, 2008, and other counties and other states. And they have great ideas, but what we build into this plan are the mechanisms. And we've identified the organizations. And again, in this county right now, we are structuring a homeless division. And this is a critical piece to your answer your question, Nick, and I probably should have jumped right into this part of it, which is, the homeless division will be created within the Department of Social Services. It doesn't exist yet. And that is going to be, a organization carefully planned with the right level of expertise built into it to make sure that this plan succeeds.
Great, thank you. Does anyone else want to jump in and add anything to that? I'm timing some of these questions just so that there's a reason for that buzzer going off. Anyone else want to jump in and just offer any thoughts to how we can get to some real change here?
Well, I think now may be the time. We'll talk about it, I'm sure, a little more, but hello, everyone. My name is Greg Gillette, and I'm here with Sam Blakesley. But the Citizens Accountability Commission, or Citizens Homeless Accountability Commission, are, just to explain what we envision our role to be, is we are not affiliated with the county. We're not affiliated or under the auspices of the county, except for with our, statutory requirements and meetings and things. But our goal is to serve as an accountability arm and communicate to the public what we find, the gaps and redundancies even in this plan. We have tremendous respect for Joe and Susan and everybody who's doing this work. But our goal in developing this committee and commission is going to be to make sure that we can track all the changes, because Joe's right, things change, there's policies, but it's still a bureaucracy. It's still a government program, and our role is going to be to put together a group of people who can identify things that aren't going right in as much real time as possible, so that we don't get 5 years into this plan and say, well, we had to change pace and we had to do some things different, and really not able to question that. So that's the only comment that I have from our perspective.
And I'll add that we are working towards a much more muscular role for the Homeless Services Oversight Council, with its very broad membership, which all the cities have a representative, as well as the county and not-for-profit organizations, businesses, community of faith, all kinds of veterans and different other groups that are involved in addressing homelessness or impacted by homelessness. And we'll be doing in our bi-monthly meetings more regular reviews of both the implementation, are we doing what we said we would do? And then the second level, which will be addressed by HSOC, but also by the Accountability Commission that Greg just described, are the things we're doing achieving the results that we hoped for? And those are two different levels that we have to continue to look at in order to make this happen.
Perfect timing. Great. So let me address this one to you, Susan. You're welcome to jump in as well, Joe. But stability in housing and service provision is cited in the plan as a requirement for long-term success in helping individuals and households. This is often a funding issue, and all of the funds needed for the plan are not yet in place. Can you anticipate how this critical issue can be addressed?
Well, it is part of our strategy with this in developing this plan that previously, essentially, the community has done whatever good we could do with whatever money could be gotten hold of, and just do as much to help as we can. And with this plan, we've taken a different tactic, which is to say, we need to figure out what our community has to have. What has to happen if we're going to achieve this very substantial goal? Which, I mean, how can we do any less? That also means that if we waited until we figured out where the money was going to come from before we developed the plan, we won't be ready to capture those opportunities as they emerge, because the cycles are not that long in applying for various grants. So we deliberately went out ahead knowing that we don't know where all the money's coming from yet, and we're going to have to nail that down over time. We do know that there is additional funding coming in, the next round of money through the HHAP program from the state. Don't ask me what the acronym stands for, but it's the latest of the major state programs is about a $4.3 million chunk. We have also, some of the communities are dedicating ARPA funds, and the county's using some of their ARPA funds that are Recovery Act funds from COVID. So we have some of this money that we're lining up. We also have some of round 2 of HHAP yet to designate. Round 3 of HCAP does include from the state a specific expectation that money will be used to deal with capacity data type issues. And so we will be able to defund the data work with dedicated money that's part of that.
Sounds good. Do you want to add anything, Joe or any Sam or Greg on that front?
Yeah, this is Joe. I'll jump in. Can you hear me?
Yes. Mm-hmm.
Okay. And just very quickly, going back to the last question too, off of what Greg had said, I just want to emphasize that we, welcomed greatly the idea of having an accountability commission, which I'm sure we'll talk about, just to help bolster, I think, the credibility of what we're doing. So it's, and we're very appreciative that Sam and Greg are taking the effort, pretty much, pro bono, for lack of a better, word, that to do that work. Because we want to be held accountable and look like we're being held accountable to an independent, body. So I just wanted to say that piece. And then as far as capping up what Susan had just said, yeah, I mean, part of the strategy here, one of the lines of effort that we have in this strategy that, again, if you took any of those lines of effort out, we think the strategy would fail, is funding. We need to more aggressively pursue new funding that we're not aware of. By building a homeless division and streamlining, braiding together funding throughout the county that at the moment may be a little fragmented in the sense that there is a lot of money that comes down directly from the federal and sometimes the state government in many forms and departments in the state government. And that money can get directed to different parts of the county with all good intentions. Well, and with an intent to address homelessness in some way. And we feel by creating a homeless division and having the right level of staff and analysts to look at that funding and braiding it together, it can become a magnification of the funding that's out there by bringing it together, where you kind of have that whole concept of the whole being greater than the sum of its parts. And right now, I just feel like a lot of the funding is out there and it's being fragmented. So we can improve funding by, one, increasing the level by identifying new sources of funding with a more aggressive approach toward that. And then we can actually improve the efficiency of how that money is spent by streamlining it all through the same lens within the county out to homelessness, rather than being fragmented with nine different strategies within the county itself toward homelessness, with all the different departments, again, best intentions, but doing the things that they see addressing homelessness. It needs to be brought together.
Sounds good. Sam, let me get you involved. We'll jump ahead a little bit because the Citizens Accountability Commission has come up a couple of times at this point. Can you talk a little bit about it? How is it going to work? How's it different from the HSOC? How do you see it holding, the county and the other jurisdictions accountable in this process?
Sure. Well, to start off with, of course, as Greg noted, we are connected with but independent from the folks who are actually delivering services or making policy decisions. We see our role as representing the citizenry in sincerely desiring to see the problem get fixed. Now, we all know how challenging the problem is. We can talk endlessly about the cost of housing or the impact of substance abuse or what the funding may or may not be. But to the average citizen, what they're seeing is the problem's getting markedly worse across the state. It's no longer what's happening in San Francisco and Los Angeles and Santa Cruz. It's now happening on our streets. We're seeing the problem is getting more severe and advanced. The homeless are everywhere in our community. In many cases, the challenges are not just environmental in terms of what's happening in our creeks, but it's safety. People are threatened and assaulted. I've been assaulted. We know the mayor, Marks, had been assaulted. There are instances to people who are simply walking down the streets with their family that have never happened before in this community. And I think Greg and our involvement was a reaction to that sense that, yes, good people are working incredibly hard, but where are the results that we as the citizenry expect to see? And so the approach that we took was to do a very thorough analysis of what's happened in the past and past plans, because there have been many plans in the past to deal with this issue, which, notwithstanding the good faith of those who worked on those plans, did not result in the outcomes that we as the citizens expected to see. Greg and I put together a pretty aggressive and ambitious proposal a year ago on how we felt all these efforts could be reorganized. And we were heartened to see that Susan and Joe and their recommendations to the board adopted many, though not all, of the things we recommended, which is fine. But the good faith effort that they engaged in taking some of our recommendations was to reach out and say, we think you have an ongoing role to hold us accountable. And we want to fulfill that role. We can go into that in more detail, but I just wanted to provide that sort of background as to how we fit in, who we see as our customer. Our customer, really is the public, and giving them confidence, which involves looking each year at the metrics and seeing whether or not we are progressing toward our goals, the stated goals in this 5-year plan. Greg, did you want to jump in on that?
Yeah, I'll be really brief, but yes, there's a lot of theoretical stuff involved here. And like Joe said, planning requires planning for multiple outcomes. The group that we're putting together are people who have practical policy experience and the analytical experience necessary to identify gaps and loopholes in what is a bureaucracy. I mean, that's not a pejorative term. It's just, that's what it is. So we will, it's easy to know when a road isn't being fixed by a municipality because we see potholes. But this is a harder thing to manage. So we're putting people together who have geographic diversity, professional diversity, but people who can see the potholes in the multiple avenues that this plan is taking. Kudos to Joe and Susan for putting together something that has lines of efforts. It's very well organized, and what the hope is that we are able to align a group of folks around each of those lines of effort to hold them accountable, to say, okay, this is what you said you were going to do, just like Susan said, And you did them all except for this one. Why and why not? What is in the way? What are the barriers? How do we move past this? And then frankly, to be a voice for the public and to report to the public. And I think that's the way that this is set up, because this problem has become so big for so many communities that it really has to have multiple reporting of accountability, as opposed to the standard going to the Board of Supervisors and then making adjustments and sending it back down. And the other thing is, the reason is because the urgency level is too high. And so we will be asking those questions so that the county can clearly, county and cities and electeds and everybody involved can have a quicker feedback loop. And so that's the goal that we have there, Nick. Thanks.
Mhm. Sounds good. And I'm seeing a lot of questions come in. We'll try to get to some audience questions towards the end here. So just to respond to those of you, and thank you guys for bringing up some of these topics. Housing and services, to get to those issues seem to be primary ways to address homelessness. This plan aims to improve coordination of provision of housing and services across jurisdictions on a countywide basis. If coordinations means having broadly similar policies countywide, how would those policies be chosen and enforced? So that's the next question for Susan or Joe. I'm talking housing and services. How can you broadly apply similar policies across the county?
I'll start out with that and then let Joe chime in. First of all, there are policies and services that need to be coordinated in two different streams of things. Part of it is what the service providers are doing. And that is work that we are coordinating through the Homeless Services Oversight Council and our services committee, and trying to get better systematic communication, improving the data that they use, so that if the Sheriff's Department encounters somebody, or Five Cities Homeless Coalition encounters someone, or they're encountered up in Templeton or Paso Robles, is there someone might be moving around or even moving back and forth across the border into Santa Maria and back. We have a lot of that too. That they can be tracked to the system, and everyone involved can coordinate the services for that person. And it simplifies the work for the person who's already kind of bewildered and struggling, but it also improves efficiency of service delivery. Secondly, there's a level of coordination between the jurisdictions, because some of the policies are about land use and planning types of policies. And that's what the regional compact is designed to handle. So that as we see where we actually have to have everybody buy off on particular approaches, that we build those things into a regional compact, so that and each jurisdiction can voluntarily agree on what they're willing to take on. That we found that would be, there's a lot more receptivity to that kind of voluntary but structured coordination than to turning over those authorities to a central group. So we think that this voluntary approach will be effective. But again, the citizens accountability panel will point out if there's something essential that we're not getting from a jurisdiction or two. How can we get there, and what has to happen? So different levels of support. Joe, do you want to add on that?
Yeah, I'd like to jump in, and again, I want to. This is probably a good moment to say what I like to say in this area, which is, so again, it's called a county-wide approach. It is not. It's a county-wide strategy. It is not the county strategy, and what that means is, again, we are taking input from leaders of all the cities throughout the region, as well as citizens throughout the region, and incorporating that into our plan. So it's county-wide. In that sense, the county should be leading this effort through facilitation and centralization of the plan, but it is not directing the effort. It is not. We are not telling the cities what they're going to do, when they're going to do it, and where they're going to do it. That is not what we want to get into. That's just not how this works. By getting together with the right leadership of the cities and this is the whole concept of regionalism that we're trying to emphasize here. By getting together and looking at the plan in a unified way, we can, as a group, look at what areas need what. So, for example, I think that in particular, homelessness, as we all know, it has a spectrum. It has a spectrum right here in this county. If you're in North County in the Salinas Riverbed, there are attributes of the homelessness there that are different than the attributes of the homelessness that you see in downtown the city of SLO versus what you see in South County. So we need to let those regions, those sub-regions of our county, identify what are the services and what are the particular needs of the homeless in that area, and make policies that address it there. And that's what regionalism is. That's what this plan seeks to do.
Great. And to piggyback on that, many times when an organization or provider proposes housing or services for people experiencing homelessness in a certain location, part of the local community objects to that location, NIMBY or whatever you want to call it. How does the plan address the issue of location?
Our plan, I'll jump on this one. Our plan is to do, I think 5 cities, Homeless Coalition and the city of Grover Beach has learned, and they did successfully with the Pallet Cabbage for Change project, which is trying to educate the community on what's about to happen. So again, you just don't want to start doing things at the will of government in people's neighborhoods without trying to take the time to reach out and do a demonstration of, hey, this is what a tiny home village looks like. These are examples of what a tiny home village has done in other places around the county. This is how they're going to be operated. Essentially, just through open discussion, outreach, and education with the public, and and getting assurances that this is going to be safe, and the security and sanitation efforts of whatever the activity might be in that neighborhood. Like most things, at least in the civilized world, communication is the key to getting it done. But when you start doing things without communication through the force of will and authority, generally it doesn't work out very well. There are times when that is necessary. This is not one of them. This is a time when plans need to be communicated clearly with the citizenry and the public that these activities are going to take place in their neighborhoods. And I think that's really the only way we can do it. If you're going to ask, what if they reject it anyway? I think if it's done right, if you communicate it correctly, it won't be.
Nick, may I just weigh in just a little bit here?
Yes, go ahead, Sam.
So I just, I think what you've touched on is sort of the tension that currently exists between the proposed set of solutions that are going for the Board of Supervisors and the approach that Greg and I were recommending. We are of the opinion that cooperation and coordination purely through what are largely the existing mechanisms have proven unsuccessful. And if you look at some of the areas where this problem has become the most pronounced, and I'm thinking specifically around Seattle, they are adopting some of the ideas we were presenting, which is a integrated joint power authority where a number of entities give up some control, but you have much more of a command and control system that can allocate resources and enforce outcomes. That's not where we're at right now. And Greg and I totally accept our proposal was not accepted, but I wanted to point out the nature of many of these questions gets to that underlying issues, enforceability and control, which from our perspective, if it's truly an emergency, we may need to take these more Herculean efforts, and entities may need to surrender some control to have a unified command structure. Again, I'm not trying to litigate that question here during this panel as much as I'm just trying to educate those who are listening that this is some of the underlying tension that exists. There's probably a healthy tension because I think Joe and Susan have put forward a marked improvement to the current system, and it deserves a fair opportunity to be tried, because if their proposal works, we may not need a JPA. But that really is the other way to deal with these command and control and coordination issues.
Sure. And I would add it in support of that, we felt that the urgency of this problem was so great that we did not want to wait for the time it would take to negotiate and arrange and try to get every jurisdiction on board with a concept that can be very challenging for jurisdictions to give up the authority for central functions that they have. So rather than trying to get that in place, we wanted to move forward with rapid action first. And let's see if we can't get this done through a voluntary approach. If, as the regional compact develops, if we need more, a more robust set of incentives, both positive and negative, then we'll have to see how those can be developed.
And that's where,
yeah.
and that's where excuse me, Susan, I didn't mean to interrupt. There's a delay, but that's where the accountability comes in. You know, like this is a real good. Let's do this as we go along. Susan's absolutely right. We, you know, without the buy-in initially, we've got to come to these agreements organically, and I think that's what Joe has articulated really well in all of our meetings. But the accountability part of that is, are we taking too long to do that? We don't know that yet. We want to get started really quickly because there is urgency. But, you know, we will be able to tell by whether or not we meet all the metrics and the lines of efforts. And if there's one jurisdiction that has a different perspective that takes them out of bounds, and or the county has a different perspective, and we can at least identify where that dispute is and where powers are needed and where they're not. And hopefully, I think, is if we show a higher level of efficiency and effectiveness as a county, then everybody's going to want to jump on board. And that is the prayer. That's what I would ask everybody out there who works in these organizations to do, is to really understand that this effort, although I don't agree with all of it, I don't think anybody needs to, is pushing us in that direction to where we get to make good and fast decisions, and not have to practice in the what if and wherever. So I think that's what our role is the Accountability Commission.
Sounds good. Let me jump into a shelter / permanent housing related question. I'm seeing audience members ask about incentives for developers and just really trying to meet the housing demand, which is obviously we all know about that and it's a huge issue. But according to the plan, the pressing immediate need is for shelter, and in the long term to build more permanent housing. How would you do this in the face of how expensive the slow housing market is? Susan or Joe on that one?
Sure. We have in developing the plan, we looked at how much could be done of each type of housing, and actually developed a quantitative model for what would need to be achieved. So with the more permanent types of the traditional permanent housing is predominantly tax credit financed. And so we're looking at ways to how can we strengthen, support local contributions to make the most important projects of that nature happen more quickly. And how can we at least look at what's in the pipeline and figure what needs to be accelerated and which things might be of lesser priority from a countywide perspective. And that's, we are counting on meeting the RHNA targets, the Regional Housing Needs Assessment targets, being met in each jurisdiction. Cities will all tell you that they don't build housing, and they don't. But what we're looking for is to coordinate that effort and to work. I know Supervisor Ortiz-Legg has added some things in comments about an effort to replace the funding source that the county had for some of their contribution to this, through their inclusionary housing ordinance, to replace that with a different source of funding, and look for options there. At the same time, in terms of the more temporary types of housing, to building that rapid pathway out of homelessness, we're predominantly looking at projects that will occur on publicly owned lands, because it allows for waivers of building codes. and other kinds of flexibilities that accelerate the process.
Great. Anything you want to add to that, Joe?
I mean, just a general comment in the sense that, you know, I readily admit that we don't have all the answers, right, for all aspects of this right now. What we're also hoping is that, you know, by generating a focus that you know, that Sam and Greg definitely initiated in the community, and generating this large scale regional focus on this issue, will bring out some expertise and maybe even some new names and faces that have great ideas in this area that can lead to change, whether it's, you know, legislative type of changes or what have you. But so we just don't have all the detailed answers, and to pretend like we do is going to force me to tap dance, and that's embarrassing. You know, I'm not going to do that. So we just say that right now we know that is a critical issue. We do have what Susan just outlined are some general ideas and approaches to it, but we definitely, in any category that we're talking about here, don't have the detailed answers. But I do know that by generating discussions just like this, and forums just like this, we're going to start getting some really good ideas toward these.
Mm-hmm. And this is an audience question, but I know tiny house villages have come up as a topic of discussion quite a bit, just regionally, and homeless advocates especially, many of them are supportive. But would there be, you know, as we speak now, and this is the question, but maybe just the topic in general can be addressed, how will the county provide financial incentives to appropriate developers to encourage them to build up to 10 tiny house villages, which are the most immediate and actually affordable to house the unhoused homeless individuals? Basically, how do we incentivize tiny home villages? Would that be at least looked at as a way to spend some of the public funding?
Joe, why don't you
I'll
start?
jump in there first. Susan,
Yeah,
real
jump
quick.
in and talk about the request for proposal that you have out for the second one, Grover Beach being the first.
Yeah, because, you know, Grover Beach is pallet shelter, the cabin for change is, you know, it's technically a tiny home village. And right now, I think, you know, again, the way to do this is we have to first, and rightly so, we have to prove that these are effective, right? I mean, I know that, and I speak with homeless advocates daily in the community, and we can look nationally at examples in Austin and Oregon and Seattle at tiny home villages that are successful, and that's great. But every community is different, and every community, I think, needs to be proven to them that this could work here. And once we get 5 Cities Homeless Coalition, and you know, the county itself, we are generating some requests for proposals to build a tiny home village out on Oklahoma Avenue near what is the Oklahoma Avenue parking village. And, you know, and these are attempts to at least get the theory proven as effective before we roll it out. And if we can do that, if we can establish a couple of these villages, which I think are fantastic ideas, these tiny home villages can get people out of the riverbeds and out of the public spaces into a place where they can actually have shelter and rest and recuperate and address the things that they need to in their life to exit homelessness in whatever pathway that may be. But the key is getting them shelter, you know, first. But we get these tiny home villages built and we prove this theory, then I think the mechanisms to find the funding and make it more possible will emerge. Again, it's political will, but you can do a tremendous amount of good or bad with political will. If we prove that this works and the political will follows, then so will the policies and the incentives to make it work.
Great. So another audience question. This one deals with substance abuse. Would love to see a methadone clinic in SLO. AEGIS is interested in expanding, and they have high success rates. I know there is in SLO a drug and alcohol abuse treatment center that was introduced not too long ago. How would you address this particular question in regards to substance addiction and ways of addressing that issue?
I'll start on that. The critical area in in our services and looking at the supports people need really falls into both addiction recovery and mental health. And very often those two are combined, because people who have mental health issues use substances to manage their symptoms in the absence of more substantive medical care, and eventually end up with addiction as well as the mental health condition. Or they are abusing substances in a way that contributes to mental health problems over time. So we're looking to expand those services. The specific locations of specific types of services is a level of greater detail than we actually have in the plan. That's part of what, envision how we're moving from the document that you can find online and the link that Glenn has provided in the chat, to the level of detail that you saw in Joe's essentially battle plan of these lines of effort and all of these different steps that are achieving particular outcomes. So when we get to that second level of detail, a methadone clinic in this location for this group of folks by this operator might be one of those items, but we're not at that level of detail yet.
Okay, thank you.
And again, I could follow up a little bit on that with just a general comment, not specific to that topic. But again, this is where it gets a little bit confusing sometimes. It's a strategy, so it's not a tactical plan, meaning that we're providing broad lines of direction on what we want to do. But the critical piece is stimulating, a regional and a centralized conversation where all of these issues are brought to the same table so they can be looked at the same time by the experts, and we can make decisions in the right direction, and everyone else knows what they are. So there's awareness to our left and our right as to who's doing what, so we make those decisions and they don't start contradicting with other decisions that someone else made that we're not even aware of, that are trying to tackle homeless issues and behavioral health and addiction issues in a different way. We need to, bring all this together in the same conversation. It'll be very helpful. But I just wanted to emphasize that, as Susan said, it's a strategy. So there are a lot of details. It's just like trying to say we're going to get from Los Angeles to Atlanta. That your strategy is to head east, but it depends on what kind of vehicle you have is going to determine what roads you're going to take, and that's more of a tactical plan.
Sure. And this maybe gets into the politics of the county to a degree, but a couple questions from the audience came up around inclusionary housing ordinance, and I know that was terminated. We don't know, it could come back in the future. Do any of the panelists have suggestions from this audience question, have suggestions as to the next steps that should be taken to address inclusionary housing countywide? Maybe there's alternatives to what can be done currently. Maybe that needs to be looked at again. Where are we with that?
I'll simply comment that essentially what we need for the tax credit financed permanent supportive housing projects and low-income housing projects is a contribution locally between the cities and the county, and in various ways they can get these funds, of about $40,000 a unit. That's what it's taking to get these projects competitive in the market for that tax credit financing that we don't get to choose. Our projects just go up there. So I am perfectly comfortable with jurisdictions finding the best way in those jurisdictions to come up with the funds. We may want to look at coordinating across jurisdictions and some 2 or 3 communities in the area might pool funds to support a particular project that will help all of them. But however they come out with the money, I just want to make sure that we have the funds to make these projects move forward. There is the opportunity for different answers that work in different communities, but doing nothing is not an option.
Sure. Yeah. Thank you for that response. So I know that, again, if anyone wants to bring up any topic in particular that, among our list of questions and audience questions, feel free to jump in, Sam, Greg. I've heard this from multiple people that there are different groups of homeless community members and have struggle with challenges at different stages of life, whether they're younger, have families, elderly. Does this plan suggest priorities among these groups for housing and services? And would the plan permit program managers to choose priorities? So I don't know if that's a Joe question or something anyone else wants to weigh in on, but just distinguishing between the different needs out there, would there be that flexibility?
Joe, do you want to start that?
I'll just take it real quick. Yeah, just real quick. It's similar to my answer earlier, which is that we know that the cities themselves, will have a better idea, and in the regions themselves, will have a good idea of what are the the different breakdowns of the homeless, the types that they have in their areas, and we'll have better solutions for that. Again, so that's where we look at the county, leading the effort, but really just helping facilitate all of the county regions and the cities themselves with the ideas that they're going to have to address the homelessness in their particular areas based on how they see it. And that would include everything you just asked in your question. What is the type of population, the majority of population they have, and therefore make that the priority? Do we have mostly, single middle-aged males as the homeless who have, addiction issues in our area, whether that's, North County in the Riverbed, or do we have, families, mostly, homeless that don't speak, English or something in say South County, whatever that mix may be in the regions, they have to determine what the priorities are.
Right. So I would add to that over time, as we get better data, we'll be able to make more refinements so that when we get to the finalizing a regional compact with significant targets, we can do those by population, and we'll also be able to better track who's getting stuck in the system and where do we need to make efforts so that episodes of homelessness are both infrequent and short. We want to get people back on their feet quickly. We know that there are differences regionally. So for instance, in the city of San Luis Obispo, there is concern about being able to separate families and single adults in sheltering options so that there's more flexibility in supporting the single adults who may not be suitable in a you might not want to mix into a family environment. So, and to support the family separately, that's a big issue for getting flow through 40 Prado and what we see in SLO. In the North County, what we're seeing, particularly in the Paso Robles shelter, is that the Echo Paso shelter is filled night after night after night with older adults with substantial medical comorbidities who, when they move to permanent supportive housing, that's not really an environment that's organized for the set of needs they have, and they're not necessarily thriving there. And so they're falling back into homelessness. And they're not easy to place out of that, partly because we don't have Medi-Cal nursing homes in the county for other reasons. So we're looking at how can we create a more active partnership with the healthcare sector to deal with persons with medical needs so that we can have them move into better environments that support them and also free up shelter beds so that the younger folks with addiction issues that are also trying to get a little shelter and stability have a place to land.
Great. Because go ahead.
Quick?
Yes.
As important as these detailed questions are in terms of parsing and dividing and understanding the dozens of sort of subsets in this very difficult problem, we oftentimes see in the major metropolitan areas a certain paralysis by analysis, where armies of consultants and in-house staff spend enormous amounts of time creating documents that voluminously describe how complex the problem is. And they kind of lose sight of the forest for the trees. And I want to really emphasize something that was front and center in Susan's presentation. Currently, we only have enough beds to shelter between 20 and 30% of the homeless population right now, based on our current point in time count. And that could be debatable as to how accurate that is, or whether or not we're properly counting people. From the perspective of the accountability, Citizens Accountability Commission, we really want to look at these metrics. We want to see beds. We want to see that number come down, the point in time count number coming down, the beds coming up. We want to see housing in all the various jurisdictions. We still want to see the cities performing, and we want to see coordination between the city and the county. And I bring this up only because I just want to caution people to remember the scale of this problem is enormous. And if we aren't working on the big things first, we can get lost in some of the really complex and subtle debates about the nuances that exist in this very challenging problem.
Yes,
Well
and that's
said.
a good point, because this is a very complex problem. As you can see, we're dealing with many different topics and potential solutions. Why don't we do a wrap up where each one of you can just share whatever's on your mind at this particular moment? I know we can extend as much as you guys want, but I want to be respectful of people's time as well. So why don't we just go around and maybe each one of you can share whatever is, you'd like to at this point in the discussion. But that's helpful, Sam, just to recap on the big picture here. But Greg, do you want to kick it off and just, give us your thoughts on why anything you'd like to say on this?
Yes. So thank you guys. Thank you, everyone. Thank you to the League of Women Voters for just having this discussion week or month after month. I think Sam and I worried that there'd be fatigue around this issue. And so everybody in their own way has acted as quickly as possible, at least in my perspective, since we started having these discussions. And it is talks like this that are so terribly important for all of us to have to keep the momentum going. And so all the questions that I've seen are all not just valid, but they're very good questions, and they need to be answered. And the other thing I'd like to remind everybody is that once we get this coordination, and we need to get it as quickly as possible, these questions will be answered naturally and organically. If it's not, the Citizens Accountability Commission is going to bring it up and ask those questions out loud. As soon as we get into the tactical responses Joe was talking about, we can have those questions raised at different levels so that we can get those things. For example, the HMIS system, we don't have the metrics yet. We have people who are ready to support. The county is ready to move forward on doing that. And we need to do that very soon. And Cal Poly has been awful responsive in willingness to support. And so that is one of the questions that we as the Citizens Accountability Commission will be asking: when, how quickly we can do things. And again, I want to reiterate that this commission, we started just me and Sam separately, and now it's being codified in a way, but we're still independent. We don't have any ties except for the respect that we have for the people doing the work at the county and the other places. We really want to be the voice of the public for this and ask hard questions and put together a committee of very thoughtful citizens to ask these questions. So with that, again, I want to thank you. I appreciate everybody's support with this going forward, and we have to get this done. And this is a good start. This is a really good start. Thank you.
Great. Susan, do you want to weigh in here?
Sure. I think that the thing to keep in mind is that homelessness is an urgent and complex challenge. It is not something that somebody else is going to solve for us somewhere else. It is something that we have to work together to solve in our community, for our community, for addressing the needs of people who already are living in our community and fall out of housing into homelessness. And how do we create those pathways back? There are opportunities for action at every level by every person. things that one of the things that we will be doing is to try to create a mechanism so it's easier for people to see where they might volunteer. But you don't have to wait for that. You can call up ECHO or 5 Cities Homeless Coalition or 40 Prado and say, how can I help? You know, I'm willing to provide a casserole. You know, there's I'm part of a church that has people cooking casseroles for 12 and putting them in the church freezer so that when ECHO doesn't have somebody who can serve dinner, there are casseroles that can be brought out and served. Now, all kinds of different things that, you know, individual groups can do. If you are a property owner, consider building an ADU. You're not going to, an accessory dwelling unit. You're probably not going to put somebody in there who's just coming straight out of the riverbed, but maybe somebody who spent the last year in a supportive environment and a little thing and now has a job and a track record of serving the community around them and is stabilized their life. Maybe that's somebody that you would consider, or maybe you would consider housing somebody who is working with homeless people or working to provide mental health services in our community, because those jobs, we need to recruit people into the jobs that make make these pathways out of homelessness work, and those folks need housing too. Same dynamics. So all kinds of things that individuals can do. If you're in finance in a banking organization, how well is your bank making it easy for people to build accessory dwelling units? That's it. You know, are there market opportunities? Can you do things to help people who are in temporary housing situations or shelters and are saving up money for things? Maybe you'd like to, you know, match something. There are opportunities for charities. Many ways that we can all be involved. And I encourage people to find what it is that they can do and to be supportive of their political bodies in making what will be often tough decisions about locating these services.
Mm-hmm. Joe, what are your thoughts just to conclude here?
Yeah, mine are really related to what Sam had mentioned at the end. You know, it just really can't wait to get started, you know, doing something. Again, we have to take some time to analyze. You know, you don't want to rush to failure when you can walk to success. You know, so we definitely have to have a measured pace to understand what we're getting ourselves into before we make the first move. Because you don't want to get in a situation where you're spending more effort backtracking on bad decisions, you know, than you are moving forward with good decisions. At the same time, you know, we have to do something to get a reaction so we can have a reaction to that and take action to that rather than being reactive all the time. Again, I look at it from a sort of a historical military analysis. You know, a lot of times when you have a large occupying force that comes into a society, that society will oftentimes develop, you know, into different factions of what you call insurgents. And those insurgents will have the same goal, which is to remove the occupying force. But a lot of times those insurgent activities themselves begin to disagree with each other and they start to fight each other. And as a result, the occupying force grows in strength. In this case, the occupying force is homelessness. And there are a lot of people out there who have their ideas about how to deal with it, but they start disagreeing with each other so strongly that they become ineffective toward homelessness as an occupying force. And we can't do that. We need to bring everyone to the table with the right ideas, and they're all welcome in different capacities. The trick is figuring out the fine tuning of all those different answers so we can get the right answer. And they're all out there, but we can't fight, you know, take the time to fight amongst ourselves and with disagreeing with this approach or that approach. And my point is, again, related to what Sam said, you know, let's just get started.
Great, thank you, Joe. Sam, do you want to have a final word on this?
So I remember in the 90s, I visited New Delhi in India and being shocked by the untouchables. You'd walk down the street and you'd see streets lined with people living on the street. And I remember as a Californian, just shaking my head, asking how could any society allow something like this to exist? And when I began seeing that begin to unfold in California, and in particular on our streets 5 years ago, I began to really see this as the great ethical issue of our generation. And every generation is challenged with a great moment where they have to decide if they're going to step up and address that challenge. And from my perspective, and I know from Greg's perspective, and I think from everyone's perspective on this call, we all see this as an enormous challenge, not just, economically or from a complex policy perspective or from historical perspective, but in terms of an ethical challenge. Will we be a good people that solve this problem? And from our perspective, and I'm speaking just for Greg and myself right now, we believe we're still underestimating the size and scale of this problem. And we need to bring more resources, more effort, more focus, and a more aggressive approach toward problem solving. And we want to do our part in helping move this process forward. And we commend Joe and Susan in particular and the Board of Supervisors for being proactive and forward leaning. And we want to be a part of that process. And if we can add a little jet fuel to that tank to get it going a little faster, a little further, then that's what we'll do.
Hopefully the cost of jet fuel isn't too expensive then. So great. Well, thank you guys. This is a great discussion. I'm sure there's many more questions and topics to address, but for now, let's end here. And I'm, in the many different forums and ways of communicating on this issue, I encourage everyone to do so. I know it's really important. It was a big part of our coverage area, news regionally, and I think these conversations are really useful and just part of the ongoing discussion. I think it's really important to emphasize this is one discussion, but there can be many more to advance and help along these lines. So thank you to the League of Women Voters. Thank you to the panelists. I appreciate everyone's participation from the audience, and stay tuned and we'll be in touch next time. So I will sign off here on my end, and thank you guys.